Oh, Sharpay, yeah. Sharpay. If you're just joining us, we were talking, some folks have, just sagging jowls. And
I do.
And that's a problem for some folks, and they want to get something taken care of. But the question is, what's the best way to reduce my sagging jowls? And this is Dr. Bilski. And oddly enough, this is not a doctor of medicine. This is a doctor of dentistry. Yet,
right.
You can help with sagging jowls.
Yep, we can.
How do you do that?
Well, believe it or not, it's as simple as a 20-minute appointment with a laser.
At the dental office?
At the dental office.
Who would have thought?
Yeah. So my training, I've been 35 years with this, plus the 4, it's about 39 years total, learning about oral cavity, the head, neck, face area. Yeah. So why is a dentist taking care of jowls? Because we use intraoral lasers on a lot of things, and what we're finding out is that using the laser, we can point this inside, between your cheek and gum.
Yeah.
And run the laser, and it reduces the sagging jowls. It tightens.
So again, that's happening within, we always think about stuff for people cutting out here, but you're talking about you're actually inside here.
Yeah.
From the inside out.
It's tightening and shrinking the muscles that tightens everything and lifts.
That's pretty cool.
It's no cutting.
Yeah.
No anesthetic, no Novocaine. It's simple.
Well, that is simple.
Yeah. And it's all based on, how old you are. So if you're a 50-year-old person, 5 appointments. If you're a 30-year-old person, we leave it open-ended.
And that's just because of the age and the amount of how loose your skin. Yeah, okay, that makes sense.
What have you done all your life?
Sure, yeah.
Maybe you had been a heavy person, and then you're 45 years old, and you said, forget it, I'm losing the weight, but now you still have these jowls. Or particularly, I think, I don't want to pigeonhole, but young grandmas. Yeah. They're still vital, they're in shape, they're pretty good, but they're noticing that they're getting the sagging.
What just happens? It's gravity. It's gravity and looseness.
They start asking about, can we do Botox? No, you can't do Botox. Can we do fillers? I don't want to do fillers there. What can I do? The only option you had was facelift.
Sure.
Well, that's surgery. It costs some money.
That costs a lot of money. Plus, there's a little bit of pain there.
Yeah.
You're worrying about could it leave a scar, but this is from the inside out. We call it laser, but it is, but it's kind of like a light. It's not like it's.
No, so there are different types of lasers. Yeah. There's contact and non-contact.
Yeah.
These are non-contact lasers. It's a light source that has energy that we call it preheat or warm, and then we get the more intense laser, which doesn't hurt. There's no downtime. There's no needles. There's no Novocaine. And you can go and do whatever you want to do. You can go exercise if you want. You can go have a meal following that. We're going to probably ask you not to drink a hot cup of coffee.
Oh, okay, yeah, right.
That's a little ridiculous. But the point is, you could.
Hey, you know what's sort of neat about this, too? You're getting this done. You're picking up your jowls. And nobody's going to be the wiser that you're having this done because you're just going to the dentist.
All we're doing is we're trying to get you younger from the inside out. And the way you do that is the energy wavelength that we use from the inside takes care of it.
It's painless. Nobody knows you're having it done, and it's going to work. And it just depends. Remember, one therapy for each 10 years of age.
Pretty much.
Roughly.
We always say a minimum of 3 because some respond more quickly. In other words, if you're 40 and we do 3 services, we might say you're fine.
Well, question, is this something that you're going to notice when you get out of the chair 20 minutes later?
So, no, not 20 minutes later in that regard. It's definitely a healing process that we call healing, a regenerative process. So we're going to reverse aging for a short period of time. And we like to see our patients every 21 to 28 days, so 3 to 4 weeks apart. So most of the time, you're going to see a pretty good result at about 2 to 3 months.
Wow. Pretty neat.
But how many 30-year-olds are coming in for this? Yeah. Not very many. Yeah. Do we see 50s? We see a lot of 50s.
Wow.
Yeah, a lot of 50s and 60s, even 70s and 80s. Back in the day with Botox, they said once you get to 67 years old, they start talking about facelifts. It's just not as effective because of muscle tonicity. It's just it's not a good idea. And with a lot of the laser stuff, we'll talk in another show here about why you'd want to use a laser.
Well, let me ask. So somebody's watching this right now going, I'm thinking, and they're going, what's the next step right now? Head to your website?
Go to the website, click on the box to schedule an appointment. It's a no obligation, free thing. And we also have a little book that we give. It's called Care Aesthetics. It actually talks about facial aesthetics, cosmetics, and how doctors or dentists like myself can handle this. It's a non-invasive thing, but it's a good way to get in. It doesn't cost anything to get it. You get a gift, you get the book, and it shows you what procedures you may be interested in.
Neat.
So instead of me trying to explain what I think you should do and maybe be offensive with what is not my intent, but you would specifically come in and say, hey, I got these jowls. I looked at that QR code within that book.
Cool.
What exactly do I need to do? And most of it is checking out me and checking out the facility to see if it's a comfortable place and they feel comfortable. Then we just move forward with it, and we're seeing great results.
Well, hey, I tell you, the next thing you do right now, head to the website, bilskidental.com, make an appointment, stop in, get your book, take a look at how this thing works, meet the doctor and some of his friends, and get ready to tighten up that old jowl.
Getting younger from the inside out.
I love that, inside out. Hey, thanks for watching.
Thank you.